Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Dr. Adam Rosen. Thanks for joining us today, Adam.
Yeah, thanks for having me. I'm really glad to be here.
I'm really glad to have you. I'm glad we're finally able to have this conversation. And I'll have you introduce yourself in a moment, but by way of a brief introduction, Dr. Adam Rosen is an orthopedic surgeon, author of the Knee Book, A Guide to the Aging Knee, meditation teacher, and podcast host, Total Knee Tips and Pearls, and Your Knee, Your Health. And as a physical therapist, I've treated many patients with their knee replacement, so your work is invaluable. So thank you very much for everything that you've done to help patients.
Yeah, you're welcome. Yeah, and it's interesting because, I get patients that are, and friends and family that ask all over the country, like, who should I see, which doctor? And you can give them names, but I said, if you can ask a therapist in your area who to go
Mhm.
to, you see all the good and the bad, so you know better than anybody, who does the best job.
Yeah, that's true as well. Yeah. And I reached out to Adam when he shared his YouTube channel episode, Confessions of a Gen X Surgeon, My Battle with Depression and My Mental Health Journey on LinkedIn back in September. And Adam shared in the episode description, September is Suicide Prevention Month, and I wanted to speak up and speak out. Whether you work in healthcare or not, we're all at risk of depression and mental illness. The healthcare system is sick and physicians and nurses are getting ill. Most importantly, if you're struggling, I wanted to let you know that you're not alone. We need to destigmatize mental health so all people aren't afraid to get help when needed. I don't want it to be a patient of mental illness. I want to be an advocate for mental wellness. And I agree 100%. That resonated so much. That's when I reached out to you. It's all critically important. And as you know, I lost one of my very own doctors to suicide. And I say all the time that every time a doctor shares their story, another doctor feels less alone. And today we'll be talking about Adam's story, what's helped him overcome challenges, and tips to share with colleagues. And I want these episodes to offer a message of hope. So, what would you most like our audience to know about you as we begin our conversation? You can include hobbies, anything, and we'll take it from there.
Yeah, I mean, the sort of the brief, bio. I was born and raised on the East Coast in Philadelphia, and trained there, and came out to the West Coast for fellowship training, where I've been since 2005. So I'm kind of an East Coaster transplant to the West Coast. And when I'm not working, over the decades, activities have changed. Definitely with kids in the picture, it was a lot of stuff with kids, and I definitely tend to lean towards the outdoor activities. In the past, used to do a lot of rock climbing and mountain biking and snowboarding, and now with the ocean pretty close, we've done a lot more paddle boarding and snorkeling and things like that. So we kind of stay busy, but I think the hard part is this job takes so much time. And although I've always heard from like my kids and my wife, oh, you did so much, you were always there. I always felt guilty of not being there as much as I had wanted to, because I would stay late, work late, had an add-on, was on call. So there's that definite work-life balance that was important early in my career. And I think I probably did it quite well. But after 20 years, that definitely changed.
Yeah, wow. I know it's a lot, and a lot of people don't realize it. They just don't think about everything that happens behind the scenes, right? They just see you when you show up and do your thing, and they don't realize. So what would you like to tell us a little more background about your story and about that episode on your YouTube channel?
Yeah, I'll tell you, it was interesting because I was one of those people that always dealt well with stress. Like stress never bothered me. I never felt anxious. Like even when I was doing some of these extreme sports when I was younger, I always felt calm, cool, and collected. In the operating room, complication occurs, calm, cool, and collected. I was able to get everything done and multitask, and didn't seem to phase me. I had started meditating maybe over a decade ago. So that was really kind of part of my daily routine. And then I created the podcast during COVID because I felt there was a need to educate residents and fellows that weren't getting training and patients that weren't seeing doctors. And one of those episodes was on physician suicide, burnout, and mental health. And I just put it out there at a point when I was doing actually okay. And a resident actually reached out to me from a program here in Southern California and just told me how much that episode spoke to him because he was struggling and dealing with a lot of issues. And I was asked to come and lecture. So I had created a whole PowerPoint lecture on physician burnout and suicide and was scheduled to give it on a Friday. Mm-hmm. Now, the months leading up to that is when life got crazy. So, and I'm sure most people that work in healthcare can understand and kind of commiserate because since COVID, we had staffing changes. So for me, I was dealing with staffing changes in the office and in the operating room and on the floor of the hospital, even in the sterile processing department. And then on top of that, we're trying to do our job. Supply chain was impacted, so we had less equipment. You had more demanding patients because places were being shuttered, surgeries were being canceled, and they were getting angry and upset. And then it's been talked about even more recently in the past few weeks, but the insurance company issues have been a plague of healthcare for years. So the whole delay and deny, surgeons constantly and doctors want tests and surgeries and medications for their patients and are told by some insurance company that, no, you're not allowed. We don't believe it's appropriate. And then you're on the phone advocating for your patients throughout the day, free of charge, to try to get the care that you believe they deserve after all of the years of training that you've had. Then you add in administrative burdens. And then you add in just the time constraints, again, of balancing your own health and wellness, your family's health and wellness, financial means, because, for me, it took about 15 years to pay off medical school loans. So a lot of doctors coming out of school have loans to pay off and they're trying to raise a family. And then on top of all of that, which I think most doctors have dealt with, I had two complications. One was an acute surgical complication. One was a patient that I had taken care of a decade ago, came in with a problem that needed to be addressed. And they're stressful. I think a lot of patients, and I understand they worry about the issues that occur when there's a complication, like what could have been done differently? What do they have to do going forward? How is this going to affect them? But a lot of patients kind of forget that the surgeons take that burden home too. Like, we did something that harmed somebody and we're trying to fix it and we lose sleep over it and we get stressed about it. Then you add in, I got named in a lawsuit. So patient had a surgery elsewhere. I just saw them for a second opinion, did some tests, worked things up, gave them a plan. They sued the other doctor, but I got named in that. So that, again, adds more stress. So with all of this, I was sleeping less, stopped exercising, stopped meditating, which to me, I now know is a red flag. Needed to have some oral surgery done that was complicated. So, again, like you and I were talking, as the patient, now I get to be the patient and suffered a complication, and sleep suffered even worse. So over the months I was struggling, the past week, I just declined, and horribly declined, to the point where I remember on Friday barely being able to get out of bed. Again, like most doctors, suppress and override. Got a full clinic. There's no substitute teacher. I need to get in and go. I know I was pretty disheveled. I definitely wasn't present because I don't remember much of that day in the clinic. Luckily, I wasn't operating that day. And I had been seeing a therapist just to talk about things. And I remember she'd always said, call if there's ever a problem. And I called her after I got out of the clinic because I was stuck. I was literally halfway to the parking garage and couldn't move or walk. And she said, hey, if you need to go to the ER, go to the ER, safely. If you can get home, get home. And I got home and I spent about 3 weeks in bed, unable to talk or verbalize what was going on, didn't eat, lost about 20 pounds. My wife was, grief stricken. Like, what do I do? Like, she was lost. And luckily I had support. So I had my wife, I had my therapist, and they were able to get me into a program, and get me, the help that I needed. But it was a scary thing because you feel so strong and you feel so resilient.
Mhm.
And then without like being punched in the face and, going into a coma, you basically have your life physically and mentally turned upside down. And it was a tough year. I was out of work almost a year because I was so disabled. Um,
Mhm.
and I did a lot to get better. Like my wife kept saying, like, you're putting in the work, like you're doing the
Mhm.
work to get better. And that's where, after a year and finally being able to get back into the workforce and seeing patients, I started talking to people because for months, many of my partners didn't even really know why I was out. They just know it was a health thing.
Mhm.
And I kept thinking, if I had a heart attack, I would have walked back in and be like, yeah, I had a heart attack. They put two stents in, or, oh, I had, cancer and they took out a mass and I had radiation. And nobody would think twice about telling everybody that.
Mhm.
We accept that. But, because it was mental health, um, you know, I felt weird about talking about, do I talk about it? Do I let them know? What would they think of me? What would patients think of me? Like, would they want me to be their doctor? Probably wouldn't care if I had a heart attack, but, I had a mental illness, do they want me caring for them? And I finally kind of had this feeling like when I was younger of, I'm going to be fearless, and I was watching a show on, what was it on Apple on, Shrinked. I don't know if you've seen that. We really liked it. It's a great show on Apple about therapists and cognitive behavioral therapy, which I went through. But one of the characters said, "Bravery is not doing it. Bravery is being scared and doing it anyway." And I
Mhm.
was like, That's kind of a good line. It's a really good line." And that's what it was. It was, we were taught in cognitive behavioral therapy, like if you're scared, just do it scared. And action comes before motivation. You might not want to do it, but you got to do it. So that YouTube video on my channel, like I do a lot more education for patients. That one was more just natural, no script,
Mhm.
talked. Actually, I didn't edit it. I actually haven't gone back and watched it. And the the comments and phone calls and text messages that I've gotten have 100% been positive. I kind of expected something negative, like, oh, you're weak, you're not cut out for this. And, you know, something. I kind of expected that. And I just was hoping to help one person. And the number of responses from people that I got that it really reached out to them and hit them and made them feel better, that was like the greatest thing in the world.
Wow. Well, it is very powerful. I watched it, and it was around that time that I reached out to you. And I'm sorry for everything you went through. I'm glad that you're okay now and you're using your challenges to help other people. And it's just, it's so important. And when you talk about doing the work, I think some people don't, maybe understand that so much. Would you like to speak a little bit more to that?
Yeah, I think and there's not one thing, and I don't sit here and say that what I did is what someone else needs to do, but my therapist was able to get me into. We're really lucky. There's a psychiatric hospital here in San Diego, and actually, a few people and doctors were like, "I think we should admit you." And I don't remember much of the first maybe 6 or 8 weeks, but I remember not wanting to be admitted to a psychiatric hospital. That stigma, and I know that you work with the Lorna Breen Foundation, and I was writing like a manuscript about this whole experience, and part of that I didn't remember, but in going back and researching it, when she had her breakdown and was near catatonic, it was this fear of losing my license and what would happen. So for me, that was a big fear, and luckily I had the support to get into their what they call their intensive outpatient program. So it was 5 days a week for like the first 4 weeks, and then 4 days a week for the next 4 weeks, and then 3 days a week. I saw a lot of people come and go, so
Mhm.
the time frame was patient dependent, and I definitely was there. I think more than anybody else when I was there for my treatment, um, but it helped. And take it for what it is. The majority of people in that program were either healthcare workers or military. San Diego being a big military town. So what that says about those two professions, I kind of let people make their own decisions, but there's definitely issues that can be addressed in both of those, situations. So in cognitive behavioral therapy, which was sort of the main focus, we were taught lots of things. We were taught how to deal with anger, not only the bottled up anger, but how to express anger. We were taught how to set boundaries, which I think is incredibly important in healthcare because for over a decade, I was just a yes man. Hey, can we add a patient on? Sure. Can you do this other surgery? Sure. Is patient in the ER? Sure. And in the beginning, I didn't mind it. I liked it. I thrived on seeing more people and doing more surgery. But towards the end, I felt guilty saying no. So I said yes when I didn't have the bandwidth. So, I teach, a lot of the younger docs, hey, it's okay to say no. And you can practice how to say it. So when the time comes up, you're not caught off guard. It's like, hey, I'd love to, but my plate is full. Mm-hmm. Like, thank you so much for thinking of me, but I can't right now. Please feel free to ask me in the future. And finding out things that roll off the tongue for each individual is helpful to set the boundaries. And I think the younger generation may be better at that. When I trained, there wasn't the 80-hour work week, and the old guard was you just worked. And I remember in the beginning of my career, I worked 5 days a week and half days on Saturdays most weeks, and that was the norm. And the younger generation with the 80-hour work week has the ability to say, hey, I'm done, I'm leaving. And they can compartmentalize work and non-work. So I think boundaries is a big key and something I learned, which is important. The other thing they talked about, which for me was easy, was the mindfulness approach. Mindfulness, has been around for thousands of years. It has huge health benefits. So this has been proven. And there's lots of studies that support this, even when they compare them to things like antidepressants, and it controls anxiety. There's two books that I read during that period that were really helpful. One was called Into the Magic Shop by James Doty, who is a neurosurgeon. And it was interesting because it's an easy read. It's his biography and story. And he explains it in how, as a young child, he was taught mindfulness. And he breaks down each chapter into like little segments of how to practice mindfulness. So it was a great story, but also a teaching book. And the other book that I think some people don't like, but I think a lot of scientific people like, it's called The Buddha's Brain, because it was written by a neuroscientist. So it talks about just the physiology and neurology of the brain and its makeup. And I found it really helpful. One of the things that I always remember that I kind of comment that they talked about in the book was how we're programmed to have negative thoughts stick to our brain like Velcro, and the positives slide off like Teflon. Mm-hmm. And, it's really easy in the world to just ruminate on all the bad things that have happened to us, or things that were said to us, or things that we did, and we tend to forget the positives. So that part of the program, is big on journaling. So I journaled every day, but at the end of every day, I listed 3 things I was grateful for every day, no matter how hard they were. Even if it was just, I ate 3 meals today, or I exercised, or I have a family. But it was trying to end each day, with something positive, which was really key. And then the other, important things that they really stressed was the idea of exercise. It's very easy when we're down to not want to exercise or have the motivation. So that was a key, and something that even lately, I've had my ups and downs. And I joined a gym a couple months ago, and it's been the greatest thing for me because I forced myself to go because I'm paying for it. And I do feel so much better, at least for a few hours after each thing. And the other big thing I think that they stress are social contacts, that a lot of us tend to isolate, and especially in this day of the electronic medical record, we're in the room with the patient, we're in our office, we're clicking away. There's not as much face-to-face interaction at work, and then we go home and we're tired. And I'm guilty of it. I give so much all day, I talk so much all day, and then I go home and I just want to lay on the sofa and not talk, and I don't have much more to give. So getting out with friends and family and having those social connections is really important. So we need to not isolate ourselves and be able to share what we're doing and feeling and hear how others are doing, because that give and take tends to be really beneficial for both parties.
Mm-hmm. Well, I love everything that you're saying, and it goes back to the doctors are human, and any struggles other humans have, doctors have as well because they're humans, and the things that you're saying that help humans: exercise, sleep, meditation, eating right, social contacts, gratitude. What message do you have for your colleagues? Because I think sometimes they might think if when they're in a low place, even asking for help can be very difficult. And if they think it's the system that's the problem, they might poo-poo some of these things, but you're sharing your own personal evidence of how they were game changers for you.
Yeah, I think the first thing for me when I created that video, it offered me, because I actually sent out an email to my partners and said, "Hey, look, I want you to know what I went through. This is it." And that was easier for me than going from office to office to office and telling my story over and over and over again. Um, and I think for me, that was sort of the first part. I got a lot of, because I did it like on a Friday, and it was like I got a lot of texts over the weekend from partners just that they didn't know, they were glad that I shared, they were there for me. I also got a lot of messages of, "Hey, I'd love to talk to you and find out what things helped you." So from my partners that, you could sort of tell that they were struggling. So I think it opened the door for that opportunity. And one of the other things that I did as far as doing the work during my time off is I became a physician coach. So I haven't done any professional coaching yet, like paid coaching, but I've used those skills in talking to people, and I've had coffee with some docs that are my partners just to listen to their story and them to hear my story so we can go back and forth. But the hard part, I think, and I'm as guilty as the other people, we have this discussion, go, "Yeah, we should get together for a cup of coffee. We should talk."
Yeah.
And then it kind of ends. And then there's like a text like, "Hey, we really should get together." And nothing happens. So even talking to my therapist the other day, we were working through that. And my next goal is to send text to these individuals of, "Hey, I want to meet you on this day at this time." Let them say yes or no, but create some sort of agenda. So I think, asking for help there is key. The problem I believe in most healthcare systems is the system wants to throw you a pizza party or offer you another module or whatever. But there's not the things that are really making a difference in physicians' well-being, because it's a multifactorial system change. It was interesting because one of the articles that I share with a lot of the residents and fellows, and I think I posted it on LinkedIn before too, was an op-ed piece by Dr. Leo Lagasse, who was an OB/GYN oncologist here in Southern California. And this piece was over a decade old now, and he talked about the struggles of work-life balance and insurers and administrators. And when you read this article, it's very poignant, and it talks about all the things. The problem is all of those things he mentioned, that was 10 years ago, and things have only gotten worse. So I think everybody believes there's a system change needed, and doctors are pretty good at fixing things. But doctors also only have so much bandwidth available. So I think many of them would love to change things, but hit a wall and just realize, "Hey, I'm not getting there, so I need to focus my attention over here." But the nice thing is I've been asked by a couple of our divisions and departments within our medical group to come and lecture to them individually. So like next week, I'm actually lecturing on burnout and suicide to the medical residents within our medical group. And then I have another one scheduled to talk to the Department of Allergy. And it just shows, it's just not surgeons. It's not any particular division or department. It's everybody in healthcare. And that's not just doctors. It's everybody in healthcare. So I think me being able to get that story out, again, like my video, I just hope that one person in that audience walks away and goes, "Okay, I feel heard. I'm going through the same things. That's how he did it. Maybe I'll try some of these things."
Yeah, well, I'm sure you'll never know the full impact of doing that one hard thing. And what, just as you're talking about it, made me think about is in our church, we have a time of like joys and concerns, when they do the prayer requests. And most people wouldn't really say personal things about themselves. Again, maybe if, oh, I need a knee replacement, right? But if they were struggling in other ways, they wouldn't stand up and say that. So this one person had lost her job at a big company and she was the primary breadwinner and she was terrified. So she actually shared, like pray for me and my family, and she got a little teary. And it was the first time that someone shared something like personal, in that way. And afterwards, everybody just went up to her. And then in the future, then other people have done that ever since. So it just takes like one person willing to be vulnerable, and do that. And I feel like the pandemic, since then, it did break open things. So many doctors went through periods of burnout and mortal injury, and that more of them are sharing their stories, and that can only help.
I totally believe that. And yeah, I was so afraid to like tell people and lay it out there. And I have a few older friends. And it's interesting because I was so surprised, even some patients of mine that saw that video. Like we would have a conversation about their knee or their hip, and then at the end it'd be like, and I just want to tell you one thing. And it was always something positive. But a number of older friends of mine and patients of mine have told me, hey, look, like back then it was a nervous breakdown, now,
Yeah.
it's a major depression. But
Mhm.
that they're like, you know what, when I was 45, when I was 50, when I was 55, like I had a nervous breakdown. Like I was on the floor, I couldn't get up, like I couldn't go to work. And you can almost see like this relief of like, oh, I can share this with somebody. Like I've been keeping
Mhm.
this inside for
Yeah.
so long.
Yeah.
I hope, I worry about the younger generation, even just not in medicine, but the younger generation, because there's so much issues with mental illness. But I'm hoping they can deal with it and talk about it more. Like even, I don't know if you know this, I learned this not too long ago, but like kids refer to being admitted to the psychiatric hospital as a sticky sock vacation. So, they wear
Oh,
the socks, the
yeah,
non-slip
that's
ones, and
okay.
they sort of destigmatized it in a funny way,
Right.
to make it easier to talk about. But I still believe, I have to believe because I still feel it. It's one of the things with cognitive behavioral therapy. You can't just change the way you've been thinking, but you can change it piece by piece, and you might make something 80% believable, 90% believable, but you still have 10% that you don't believe it. So I still feel, shame or guilt with explaining people what I went through. But I hope that, in the future becomes more normalized,
Mm-hmm.
uh, because it's not 100% of the time, but a lot of the times this burnout, moral injury, depression is the cause that leads to physician suicide. And it's just like in healthcare. Healthcare is very reactive. Like if you're sick, I'm going to give you a drug or a surgery. It's not very proactive, like, hey, let's exercise and eat healthy and do other things that are good for our body to prevent disease from occurring. And I think if we do more things to prevent mental illness from developing, we don't get to that point where people are severely depressed and then they don't think about taking their own life,
Mm-hmm.
because it's just, you hear the stories of, one more doctor taking their own life by suicide, and it's horrible. But everybody says, not everybody, maybe 99% of the time, you hear the stories of, I didn't know. They were such a caring doctor. They seemed so happy. They had a loving family. It
Right.
wasn't the person that was, coming into work drunk, miserable, and yelling and screaming.
Right.
That's the scary thing is we all tend to hide it and become very stoic and don't ask for help until it's too late. So I think the destigmatizing of mental health gets people talking and allows people to share what they're feeling so they don't feel so alone. Because that's where the other thing that I've mentioned a few times, and it's funny, it's fallen on deaf ears, but doctors do M&M, the morbidity and mortality. We get up in front of everybody else and we explain our complication and what the causes are, what the literature states, and what we did or what we should have done. Sit down, next person. But nowhere in that M&M do people get up, especially older doctors with
Mm-hmm.
younger doctors in the audience, and say, you know what? I lost sleep for like 2 nights, and maybe I hit the bottle a little bit more than I should have, or you know what, I did this or I did this, or I felt angry or I lashed out at my family. We don't share how we dealt with it. We just kind of talk about the scientific side. And I really think adding that to M&M, having older docs normalize dealing with things that are stressful at home because of what happened at work would teach younger doctors how to deal with that in the future because they're going to run into the same problem. So that's something that I keep stressing to groups, but I've yet to hear someone get up there at the podium and add that after their M&M presentation.
Well, I hope that changes because I do think that I fully understand what you're saying. I think that's really important. And I think, again, every single time somebody shares their story, it's chipping away, right? At destigmatizing. And it is, I think there is less stigma than there used to be. But there still is some. So I do think would you agree that the needle is moving
Yeah,
in
I
that
think it's
regard?
moving really slow, and I think it was so far in one direction that it has a long way to go. But
Hmm.
yes, I definitely believe, and I'm hopeful that it keeps moving in that direction. Um, and probably part of that you are hearing, and it affects patients negatively, but you're hearing more and more doctors going non-op, going part-time, cutting hours, so
Right.
it makes it more difficult for patients to get care. But I think doctors are realizing, hey, I can't go at this pace any longer. So they're putting their health first and cutting back on their hours. And
Right.
I think that's probably a good thing for many, many doctors before they just go into overdrive and their engine seizes, which is kind of what happened to me. I just kept going and going and going full speed.
Right, right. Well, and now personally, I'm hyper vigilant, and caring and worrying about my own doctors. And I had, one doctor I was just a little bit concerned about. So I reached out to another doctor because I thought they were friends. And I'm like, hey, could you check on, so and so? And he did. And he got back to me, told me the other one was okay. But he thanked me for doing that because then they got to have kind of like you're saying, like, are kind of friends, but they don't really get a chance to talk. But he made it a point to reach out to him, and they had a really good conversation. And he said to me, if you ever, are concerned about another doctor or whatever, or you want me to talk to somebody, he said, please, please reach out. So I think it helps both of them. So I had this idea. I don't know how I do anything about it myself, but like a buddy system, because like now, I mean, I'm connected with like 10,000 doctors and I love talking to doctors, but I can't check on all of them all the time and say you're okay. So I was wondering if somehow like we can start like connecting doctors to just even have like a buddy and say like once a month just do a real check-in or are you okay? How are you really? Or what's going on? Where are you in your life right now? Something like that.
Yeah, I think that's a great idea, and I will share with you that there's a couple avenues that are already in place for that. So my therapist first shared with me that in Southern California, they actually have a psychologist group, sort of a meetup where you can meet with other colleagues and then kind of share in a confidential setting maybe something stressful you're dealing with a patient, you're not sure how to go about it, or just stresses with life and home so they can understand because they're in a similar boat. And she said you should probably do something like that, like in orthopedics. Maybe, the divisional thing would be, because the concerns of an orthopedic surgeon might be different than a geriatrician or an allergist. And at the same time, a colleague of mine, and again, it comes down to this, introduced us virtually. We've kind of emailed back and forth, but nothing's transpired from that, of exactly that in our orthopedic world of total joint surgeons, of creating a community like that. Now, the nice thing is, which I'm part of, and I'll put in a little plug here, Dominic Kerrigan has a group called Physicians Anonymous.
Right.
And I have attended a ton of those meetings, and it's exactly what you're kind of referring to because it's a confidential group of doctors that can all come and be with people that are also struggling to see they're not alone, but to just in a safe place spill your guts and complain and cry and laugh and go over all of those things. And I've found that group to be incredibly welcoming and helpful. And again, it's action before motivation. There are some weeks where I don't want to sign up, and I sign up and I get there and I feel so much better for that hour. and walk away feeling better. But yeah, I agree. More of those groups, and I've even talked to our department because we've grown. I think we're the largest orthopedic group in Southern California. We're 40 plus orthopedic surgeons. I've talked to them about, hey, that would be great, but I think we should do it by generation. Like, because the younger docs have very different concerns than the older docs. You have younger kids versus kids that are already grown, and then you're middle age, you got middle age career and life changes and kids going to college. So having sort of decades of, doctors going out to dinner away from work, just shooting the breeze and talking about their issues, I think would be super helpful. So yes, I completely agree with you, and I'd love to see more of it. But I at least find a lot of solace in the weekly Physicians Anonymous meetings.
Yeah, well, that's fantastic. I've had Dom on my YouTube channel. It
I
also,
haven't
and
seen it. I'll have to
so
watch that.
yeah, yeah. So, and I'll put in the show notes how our listeners could get in touch with you. But I just wanted to thank you again for being my guest today, Adam. I really appreciate it.
Yeah, it was my pleasure. Yeah, I was finally glad, we've emailed back and forth, so it was nice to actually talk and meet. And again, I'm just always impressed that you're always smiling and always laughing. So it's always a nice thing to see.
Oh, well, thank you. I really appreciate that. And I'd like to say in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Yeah, thank you, Kim. I appreciate you.
Thanks. I appreciate you too, Adam.
Bye bye.
Bye bye.